Hello, my name is Craig Prince with CAP Insurance Services, and the reason that I am going to create this video is because with the Inflation Reduction Act and the effect that it's going to have on Medicare prescription drug, it's more important now, more so than ever before, to understand about how to go in to Medicare.gov and to look up your prescriptions and to find out what Medicare or prescription drug plan or Medicare Advantage plan is best going to serve your needs. So let's go ahead and just go into it. As you can see, I am at Medicare.gov, www.medicare.gov. It is the Medicare website. And so when I'm at this site, I want to come down here where it says Find Health and Drug Plans. I'm going to enter that here. And I'm going to just go ahead and use my zip code of 91710 as the zip code that I'm using. But that's where you would do. Sometimes if your zip code serves or could be in 2 counties, it will tell you. And then down here, I'm going to look at Medicare drug plans or Medicare Advantage plans. We're going to look at both of them. I'm going to just click on Medicare Advantage Part C plans, but I will show you how you can be able to look at both of them. So if I click on Find Plans, the next brings me to is help with your costs. So if you're on Medicaid, which in various states can be called, other than Medicaid, like in California, it's called Medi-Cal. If you're on supplemental security income or Medicare savings program or extra help from Social Security, then you should certainly press one of those buttons. If not, then just go ahead and click on this button. I don't get help from any of these programs, and click Next. And then it says, do you want to see your drug costs when you compare plans? Well, by all means, for those who have watched my other video that I have come out with recently regarding how the Inflation Reduction Act affects Medicare drug plans, whether they be standalone or through a Medicare Advantage prescription drug plan, you want to understand about what drug costs will look like. So, yes, I want to look at drug costs. I'm going to click on Next. And then it says, okay, now we're going to begin by selecting drugs. I'm going to actually use some drugs that I'm on. So levothyroxine, sodium, I'm on. I'm going to add the drug, and I take a dosage of 175 micrograms. And I take one a day, and the frequency is once a month. So I'm going to add this to my drug list. I'm going to add another drug, and I'm on hydrochlorothiazide. Click on that, add the drug. I'm on 25 milligram tablet. I only take it once per day, and so it's 30, quantity is 30 pills in a month. I'm going to add that to my list. I'm going to add a couple of drugs that I'm not on, but that so you can see what we're going to be looking at. The first drug I'm going to put on here is, let's see, I'm going to put albuterol. Okay, I'm going to add that, and I'm going to say that I'm doing a nebulizer solution. So I'm on that, and I'm going to hit Add to my list, and I'm going to add one more drug. I'm going to just pretend that I'm on I'm going to pretend I'm on an insulin, and so we're going to put it's Novolin N. Add the drug, and yeah, that sounds good. I have no idea because I'm not on this. You'll be able to see this. So we're looking at these various drugs, and so if these are all the drugs I'm on, which, like I said, I've added a couple of drugs I'm not on, the next thing we do is we choose our pharmacy option. And so let's just go in here. I actually happen to use Walmart as the pharmacy for what I use, and so I'm going to add Walmart. But let's say I want to look at CVS, and I'm going to add that on. You can see it gets filled in down here. and then I'm going to go to Walgreens. I think we'll let it go with that. Okay, so I'm gonna say I'm done adding pharmacies, and you'll see why I do this. And now what it's doing is it's going to bring up this screen, and this screen is going to tell me of these plans what plan will work best for me. And first of all, I'm going to tell you some things that I see up front. I personally, out of choice, do not want to be on a plan that has a less than a 3.5 star rating. And this plan is a fairly new plan, and its star rating is 3 stars. So I may not want that, even though it looks like a reasonable plan. If a plan can't perform at 3 stars, then it probably is promising stuff that it's not doing. Here's another plan that I would not use, a Vista. Part of it is because these are very small plans. So the first plan that comes up and that looks reasonable is Humana Gold. Humana has a 4-star rating. Their monthly premium on their Medicare Advantage prescription drug plan is a $0 copay. And it says that the cost, and it's looking at, because I'm doing this in July, it's looking at August, September, October, November, and December. It says that my costs for premiums plus prescriptions would be a total of $175. Okay? And that the out-of-pocket maximum, this plan has a $200 drug deductible, and the out-of-pocket maximum is $5,000 in network. So if I look in here in plan details, it again repeats a lot of things. First of all, it tells me that there's no monthly premium on this plan. It's a Medicare Advantage prescription drug plan. Okay? It gives me a little information on the deductible on my plan, on my primary care copay. And again, it repeats what it said before. The drugs between now and the end of the year would be $175 cost to me. So first of all, it goes over what I am having to pay, which everybody pays the $174.70 for Part B of Medicare. It reminds me that this plan has a Part B deductible. And so I go down here, and I'm going to go down here specifically to view my drug costs, okay? So first of all, it tells me that here are my drugs, okay? Here are my medications that I'm on. And it tells me that on this particular plan through Humana, the CVS and Walmart are in-network pharmacies, but the Walgreens is not an in-network pharmacy. In other words, if you will, they're out of network, okay? So I come down here and I'm going to look at copays, and what it tells me is that between now and the end of the year, my copay for these top 3 drugs are going to be $0 copays. And then it also tells me that my Novolin, if I was on that type of insulin, would be $175 between now and the end of the year, which makes sense. It's going to be probably a $35 copay for that 5 months. Okay, that gives me my $175 I'm going to spend on that particular drug between now and the end of the year. Okay, so again, they go down here and they show you the in-network benefits, and it says that I won't meet my deductible, and so basically what it shows me is it shows me my copay, and I won't hit the out-of-pocket maximum this year. Okay, so this gives me a lot of good information. Let me tell you what information it doesn't give me, and this is a Medicare Advantage prescription drug plan. But what I don't see and what I don't know from just looking at Medicare.gov for this Medicare Advantage prescription drug plan is it doesn't tell me if my doctor is part of this plan. So understand that when you're looking at this, it's going to tell you based on drugs, but it won't tell you based on whether or not the plan is providing my doctor. All right. So now if I go back to drugs and pharmacies, and I'm going to Actually, I'm going to go back a little bit. Okay, I go back to basics. Whoops, health and drug plans. I should be able to look at the prescription drug plans, and I could do that. Okay, you would do that for the same for prescription if I was only wanting a standalone prescription drug plans. But the majority of the people that I talk to, about 85%, end up looking at Medicare Advantage prescription drug plan. So this is one of the ways to look at it, and they're ranking it in this case on the most I would pay out of my pocket for prescriptions. Okay, so if I happen to be on a, let's say because I want to get to a 3.5 star plan. Okay. Notice that there's a lot of plans that are 3.5 stars or 3 stars or less, and I've said I don't want to be on those plans. So here's one, a Medicare Advantage Core PPO plan. So it's going to have a much higher out-of-pocket because it is a PPO plan, but the cost for prescriptions is still reasonable. I could go to the regular Humana Gold plan, Gold Plus plan, which is a different plan than the other one we looked at, and it is going to have a $750 out-of-pocket maximum, but it's still going to have a $200 total drug cost plus premium. So what that's telling me is my co-pays for my drugs for the rest of this year, it's an estimated drug cost plus premium cost is going to be $200 for the year. And again, I can go down in all the plans and look, because I may currently want to see what my current plan looks like. And there's a lot of plans in my state, and then just find a plan and see if I'm paying that much more being on the plan that I'm on versus if I was on the least expensive plan. And again, I'm going to ultimately at the end of the day want to check. This is a very popular plan with United Healthcare, 3.5 star rated plan. It's a plan that a lot of people have, and the out-of-pocket maximum for the prescription is significantly higher. So again, if everything else is equal, that may be a situation. Understand that when we get into the plans this fall during the annual enrollment period, and as I've discussed in my other video, you're going to want to look to see what the plan is going to do. If it's going to have deductibles for prescriptions, what the costs are going to be. And you should do that actually every year, because typically year to year our prescription needs change, and you certainly should find a plan that's going to work with the prescriptions. So I hope that this is helpful. If you need any additional help, we're happy to help here at CAP Insurance Services. Feel free to give us a call at 909-590-4405, extension 101 or 102. That's area code 909-590-4405, extension 101 or 102. We look forward to being of service to you. Thank you.